experience in surgery. I joined the liver transplant team and was so excited back then to carry a pager and get paged to go and to help harvest a liver to implant later in someone in need. So a lot of great memories through those years, and people kind of pushed me along, and I did rotations as a third year and a fourth year in orthopedics, and that solidified things. I knew that's where I wanted to be, but it didn't end up, as I thought. And going into sports medicine, I ended up deciding later to go into orthopedic oncology. And so that was, I think, a great choice for me. I did 2 fellowships. I did one in oncology and one in spine. And that actually developed kind of a roundabout way. I spent in our 4th year in residency, we had elective time. And I spent a month in Malawi as part of the Orthopedic Overseas program with Thomas Witchy. And it was there that I met this Dr. Makandaweri, who is a chief of the orthopedic service in Malawi in Queen Elizabeth Hospital. And he was taking care of all these patients with POTS disease who would come in, their family members were carrying them because they couldn't walk because they had TB of their spine. And that's when I decided that I wanted to do spine. And I came back and I was grappling with this decision. I had already planned on doing orthopedic oncology, and now I wanted to do spine and more international healthcare. And then I just kind of settled, maybe I could do both. And that was unique at the time. There weren't that many people that had done that, but I did get a chance to meet some of those folks. And one of them became a good mentor of mine and my program director for my spine fellowship, Rex Marco. And he was one of the pioneers in doing oncology and spine. I'd done both, had done 2 fellowships. And so I got a chance to work with him and then come and do a spine fellowship under him. And so I found a niche, and I'm at MD Anderson Cancer Center. That's where I did my oncology fellowship. And I have found a niche in this space and taking care of pretty complex spine and pelvic tumors. And I really kind of enjoy what I do.
Can you talk a little bit about the innovation, MD Innovation Hub that you're director of?
Yeah, so that's an interesting kind of change in my career a little bit. And it goes back to when I was a kid. I really am a tinkerer. I like to make things. I love MacGyver and all that stuff. And as part of the reason why I think I went into orthopedics, I like working with my hands. I like being creative. When I went to Malawi, I decided that I wanted to spend more time in international health. And I was thinking about taking a year off, and I did that. So I took a year after residency, and I ended up going to Liberia in West Africa. And I've continued to do work there. But while I was there, it was a culture shock. I went from New York City and Mount Sinai and a lot of technology to a very resource poor environment. They had just gone through civil war. And we didn't even have a functioning x-ray machine when I got there. It broken down, and we didn't have one in the hospital. We didn't have like a x-ray machine in the OR at the time. All these things that I kind of took for granted while a resident at Mount Sinai, we didn't have. And I started to really think about the technologies that we use and how impactful they are. And someone has to put that together. Someone has to think of that idea. They have to identify a problem. They have to go out there and do the work to create something new and put it into practice. And then we start to use it. And so I started to think about my role in that and the ideas that I had as I was doing surgeries and seeing patients and the problems that we had in some of our clinical challenges and what I could do about it. And so I started to learn more about innovation, and I actually spent a year in the lab, in the engineering lab, and Phil is shaking his head because, I learned so much in that year And it really helped me get into residency and go forward. And it's kind of started to come full circle. Now I'm re-engaging with engineers, and we're bringing engineers. I run our innovation program now for the Division of Surgery, and that's 10 clinical surgical departments, orthopedics being one of them, plastic surgery, thoracic, breast, GYN. And what I realized was that if we work together with engineers and imaging physicists and other experts, that we can really start to improve the technologies that we use. And I really get a joy out of helping other people. If they have a particular idea for a device, I might not know a lot about that particular space, but I'm very enthusiastic about helping them pull out those ideas and figuring out how we can move it along and prototype and put it into practice. So that's a really exciting part of my practice now, and it's or my career, and it kind of fits in line with the surgeries that I'm doing with the technologies that I'm using. I do use a lot of high level tech, navigation systems, 3D printing. These are all things that I kind of put into practice to achieve these the goal of ridding people of cancer. So.
Yeah, that looks like a really neat initiative. So I think we want to keep this as informal as possible. So I would say anyone who has questions, feel free to just take yourself off mute. Or if you want, you can put it, read it. But I'm sure there are a lot of people that want to talk to you. So.
Yeah, I see some friendly face. I was speaking of Liberia and David Forsh. Hey, Dave, how are you? He came to Liberia as well and did a lot of amazing work, and he's a legend out there. So. I can't hear you. I see that you're off. But...
Dave, you're on mute.
Can you guys hear me?
Yes, we can hear you.
Hey, Dr. Bird, Brother Bird. Justin, how are you, man?
I'm great. Good to see you.
It's good to see you, man. I'm sorry I'm a little bit late, so I kind of missed maybe about 7 or 8 minutes of what you guys were talking about. But man, it's great to see you. How things going out there in Texas?
Going well. Yeah.
Good, man. We miss you up here.
Miss you guys too.
So I guess, Justin, you maybe want to start from back when you were trying to decide on a specialty, and how did you kind of, did you know you wanted to do orthopedics? I know that was something on your list, but how did you narrow down to that?
Yeah, so like I said, in college, my interactions with docs was our orthopedic surgeon on the that covered our football team, and so I had that kind of concept, and I thought that would be really cool to be a doctor and work with athletes. When I came to Mount Sinai, people said, well, I said, well, I want to be an orthopedic surgeon. And they said, well, how would you know? And they said, keep your mind open. And so I said, okay, sure. So I started to look at other things. And like I said, I volunteered on the liver transplant team. That was an amazing experience. I was a medical student and, flying here and there to help harvest livers and getting some, really good surgical skills along the way. I spent some time with Dr. Dolgen. He taught our embryology course. He was a pediatric surgeon, and I thought, well, maybe pediatric surgery would be for me. So I spent some time with him. But again, I kept coming back to, orthopedics and the people that were, that I saw in the department and the patients that, we could impact. And I really enjoyed, the group and the work that they were doing. The surgeries were interesting. And again, going back to my interest in technology. So I kind of dabbled here and there, but at the end, I said, this is where I really want to be. I spent a month as a third year rotating at the time with Dr. Flato, and it was just a pilot. And I found in my life, for some reason, I've been involved in a lot of little pilots here and there. People were trying these things, and I kind of, snuck in and got some experience. And at that point, I realized, that's again what I wanted to do, be part of the team of orthopedic surgeons. Again, I still was thinking sports medicine, but those things kind of changed as time went on and I got more experience.
Yeah, sports oncology is a pretty big difference. So I guess what do you, I'm sure a lot of gratifying things about being oncology. How do you deal with the tough days and the tough patients and, those kind of cases?
Yeah, it's interesting that you say that because I do really high risk surgeries. Many of the surgeries that I do are 2 days. We'll split it up. I'll do part of the surgery on a Tuesday and then have a break on Wednesday and then the rest of the surgery on Thursday. And there's a lot of risk involved in this. And honestly, some patients don't make it through. We do our best. We have amazing teams, but you have to be very resilient and you have to understand what we're up against. And something that I learned in Malawi and Liberia was resilience. And when I went to Liberia, my friend and mentor, Dr. Sirleaf, who runs the program that supported me while I was there, he told me, when I went there, he said, I just want to warn you that you're not going to be able to save everyone and you have to take a break. And I didn't really understand what he was talking about. But when I was in Liberia, every day I was faced with someone dying, every day. And it's very rough. And the first couple of months I said, what am I doing here? And I wasn't taking a break, and his words started to, sink in. And I said, I got to take a break and I can't save everyone. And I didn't understand at the time what that was preparing me for. Obviously I was getting through that and taking care of patients. And then I come to a cancer center and taking care of, people fighting, terminal illness in some cases. And that resilience that I started to develop in those environments has really carried me through. And I think the other part is, just having a connection with people, talking to families and the patients and saying that, we can't always, have a great outcome or predict what's going to happen, but we're here to, work with you and help thick or thin. And so that's how I approach it. And I think that's what helps us get through the good times and the bad times.
Yeah. Oh my gosh. I see both Michael Parks and Evan Flato. This is like the hottest ticket in town today.
Well, these are great mentors of mine. And again, I mean, Dr. Flato, I don't know if you heard, but my
sorry,
rotation.
I had a little Zoom trouble. I just joined. Forgive me.
Yeah, so I was mentioning my first rotation. I don't even know if you know this, but you were doing a pilot because I think, as I recall, you were seeing fourth year students who were coming to you and they would spend a week with you and a week with someone else, and they would ask you for a letter because you were, world renowned, and you didn't like that. So you wanted to have more time with the students so you get to know them better. And so I was the guinea pig. I was a third year, and so I got a chance to spend that month, and that's what solidified my interest in going into orthopedics. And so I definitely owe that to you. Dr. Parks is when I was a medical student, he was always really supportive and helping me and encouraging me and telling me to go out there and get it done. And so these are again great mentors of mine, and I owe them a lot.
Yeah, there's a lot of wisdom on this.
Yeah, there is.
So we have a lot of students actually that are interested in going to orthopedics. Yeah. Theo in particular. Theo, you're a third year, right?
Yes. I actually am. I wanted to let everybody speak, but I have a few questions.
Sure.
So I've been interested in orthopedics before medical school actually, and I've been doing spine research here, and I don't know much about orthopedic oncology. Can you tell me a little bit more about what the bread and butter cases are, and then also what the really high risk cases are that you were just alluding to a second ago?
Yeah, so orthopedic
I want to hear what the bread and butter oncology is.
I was thinking the same thing.
Yeah, so like I mentioned, I did 2 fellowships on orthopedic oncology. It was more extremity work and taking care of cancers that arise in the musculoskeletal system. So bone cancer, osteosarcoma, chondrosarcomas, nerve sheath tumors. All of these things kind of fit into the realm of orthopedic oncology. And it's very collaborative, multidisciplinary. We work with medical oncologists, radiation oncologists, pathologists, interventional radiologists. So I really liked that part of it. There's a lot of planning that goes into it because every tumor is unique. So there's a lot of planning that you put into each case. You really have to understand imaging. So I have learned how to look at CT, MRI, ultrasound. I use all of that stuff in my practice. I bring that into the OR. We use CT scans in the OR and do image guidance. So that's orthopedic oncology for the most part, and why I ended up kind of developing or going into this combined practice of spine and oncology is because most orthopedic oncologists are not trained in spine. So when there's a tumor that's in, say, the sacrum or the spine, that used to be handled with an oncologist and a spine surgeon. And there's different trainings, and so you could sometimes have clashes in the treatment in real time. And I've seen that where the spine surgeon has an interest to protect maybe the nerves, and the oncologist has an interest in getting all of the tumor out. And they don't really see eye to eye. And so in my training, I got to see both sides of it. And now I put that into, I think, practice and try to balance both. In terms of the high risk surgeries, spine is high risk oftentimes just in and of itself. But when you put a tumor there, and that tumor can involve many critical structures because they don't, they don't respect boundaries. And so I've done a lot of surgeries where, the tumor is encasing, the nerve roots coming out of the sacrum or the blood vessels. And so we've had to take out a tumor and take, the iliac vessels or the inferior vena cava, that we have to resect part of, the aorta in order to get the tumor out. And so it's a really complex surgery. We have to bring in a lot of specialists. And so I've done cases where we've had, 6 or 7 other surgeons that are part of the team, multiple thoracic surgeons. We did a case a few months back where I took out 4 levels of the spine. The tumor was about this big, and one day I'll show you some pictures and video. It was up against the aorta, and so these are really difficult cases, and things could go wrong. That patient did really well, but we have to be prepared because the other thing that we're dealing with is the patient oftentimes has gone through other treatments, and they've gotten a lot of chemotherapy that's very toxic, so they might not have the best heart, even if it's a young person. Their heart might have already taken a big hit from the chemotherapy. They might have developed blood clots in their treatments while they've been getting chemotherapy. So we bring them to the operating room. We're going to do 20 some hours of surgery on them, and they already have a history of blood clots and DVTs and PEs. They already have a bad heart relative to other patients their age, and so it's a lot to ask and put them through. And so we have to be prepared for some of those difficult situations.
So you're, obviously a top center in the U.S. plus doing this innovation. What do you feel like is in your future? What do you want to do in the next 5-10 years in terms of either career or patient care?
Yeah, I think where I see myself having the biggest impact, and again, I keep going back to what can I do, with my skills to have the biggest impact, both here, the patients that I'm taking care of, but then also what can we do for other folks around the world? There's education, so training others, and again, I credit those that have trained me and given me that foundation is really, really important. And so I want to continue to do that. And so I take that seriously in mentoring others. The technology piece, again, leading our effort as a division of surgery, and then moving forward for the institution on developing technologies. I'm starting to do more of that. And then I'm honing in on the kind of the complex high risk surgery space. So I used to still do, Dr. Flavia may be happy to hear, I was doing shoulder scopes and shoulder replacements and things like that. And so, but now we have a great team. We have other surgeons in our group who focus and specialize in that. And so I'm starting to really just kind of hone in on the spinopelvic tumors and dedicate my time to that, and then the technology development stuff.
Justin, I have a question for you.
Yes, Dr. Parks.
It's so great to see all you've done. And it seems like just yesterday when you were starting out, now you've marked the world with a lot of successes, and I congratulate you. But for those young folks on the call, would you give them any key pearls that you have for translating from where you've come to where you are now? And what do you think are probably the most key things in leading to your current success? And how do they get there?
So I was given a lot of advice early on by people who said, just, stay humble, work hard. And I took that to heart. I had chief residents who, were like, just, get out there, work harder than anyone else, but don't show off, and people will notice. And so that's what I tried to do. And I tell, medical students that want to get into orthopedics, people want someone on their team that are willing to go the extra effort. When it's hard to do, they're not going to shy away from it. They're going to just get down to work and do what they need to do. One of our chief residents, when we were deciding, because carrying the pager was it was a pain, right? You're really tired. You're overworked, and we all experienced that. And it would be easy just to kind of not pay attention to things or whatever. And he was always like, whatever the harder of the two options is, that's the right thing to do that. And I was like, okay. So those are, it's basic stuff, right? But take care of people. I think that's another thing that I've tried to do, that I learned from when I was a kid and my family, and just respecting others. It doesn't matter who that is. There are a lot of people in the hospital that helped me that weren't doctors. And it was amazing in certain situations how they would come through for me. I had one situation that I'll recall, but I was in clinic, in our resident run clinic, and one of our attendings wanted a stat MRI on a patient. And I was like, how am I going to get all this stuff done? I'm seeing patients, I need to get a stat MRI. And I called, and the MRIs were being used with scheduled patients. Well, they had a research MRI available. I actually had a good relationship with the MRI tech, and they were the ones that said, oh, we can get the patient into the research MRI. So let's just get the patient down, we'll take care of it. So that happened very quickly. The attending called me and said, when are you going to get the MRI done? And I said, it's already done. He couldn't believe it and couldn't understand how we got it done. And it was just because, having a good relationship with the tech who helped me figure out how to get this thing done. And so I think those type of things will help you as you're trying to get, from where you are now into, other, positions and developing your career. Taking care of people, they'll recognize that you do think about them, and you're not just stepping on them.
I'd like to make a comment, although we're here to listen to Justin. Justin and I have talked about technology innovation. I think, was it last year we got together about that, but he's very humble and he credits all his teachers, but I've taught a lot of people we've never heard from again. And I actually spent a month doing tumors oncology with Henry Mankin. You may not have known that, Justin, when I finished my fellowship. And at the end of it, Henry Mankin took me aside and said, boy, Chick, you'll be a great shoulder surgeon. You'll never be a tumor surgeon. I didn't have the right temperament. It just wasn't the right thing for me. it's not just that you've taken everything you've been taught. You've had an ability to do all the right things in your career at the time, but always to be looking forward at the skills and the techniques you needed and to forge your own path. I mean, spine and tumor together is just one example of that. And that originality and creativity married with a sort of traditional respect for authority and tradition is a very unusual thing. And you've really had a really remarkable career, even though you keep being modest about it. It's very impressive. For the young people on the call, that's really the challenge in a career, right?
Well, thank you, Dr. Flay. I appreciate that. And I know Dr. Mencken, I got a chance to meet with him, and he was a very interesting, great guy, really interesting. He used to, sing a lot and teach.
Oh, yeah.
Quite a character.
I have another question. So I'm a third year interested in orthopedics. Would you recommend for third year medical students to be looking thinking about a specialized field within orthopedics when applying or when talking to faculty, or would you recommend students be more talk about orthopedics in a more broad way? I'm interested in orthopedics as a field, as opposed to I'm interested in spine. Is there a difference as to what a faculty would want to hear or wants to talk about?
I mean, I look at it both ways. I see folks who have experiences that are driving them into a very specific area, and I respect that. And then there are others who are still open and are curious, and I respect that too. I thought I was moving into one direction in sports medicine. I heard from other people saying, keep an open mind. And then life started to take me into that new space. I saw a patient, my first cancer patient was a young kid who came in the ER, and he had a whited out calcaneus. That whited out calcaneus was osteosarcoma of his calcaneus. And that was a clinic patient, so I took care of him as a resident. And for that particular patient, we needed to do an amputation. He was a young kid. I thought of him, he was younger than me. I had younger brothers, and so it was like a little brother to me who's going through this difficult time. But I was still thinking, I'm going to go do sports. But that started to pull me into that space. It started to make me think about how I might have an impact in taking care of these patients. And so, sometimes life does that to you. You might, have an idea that you're going to do this thing, and it's okay to talk about that, but still be open to, things that come your way and change your mind about it.
Okay, thank you. Yeah.
We have a couple of Chris, right, is interested in orthopedics as well.
I actually had a question as well. You talk, with great passion about your interest in technology and global surgery. I was curious if you had any plans or ideas on how you could bridge those two together.
Yeah, I think there's a couple of ways. One, I'm always thinking, now when we're starting to develop technology, how could you get this to the most people possible? And so, and those experiences in Liberia, Malawi, and I've been other places around the world. I'm thinking about when we develop something, is this something that they could use as well? Now, that's not the case in all the technologies that we're working on. But the other part of technology is as it becomes more available and the costs come down, then it starts to spread out. So, that's I think something that I also consider. When I went to these places, cell phones, they may be very, poor in a lot of these areas, but they have a pretty good cell phone, and and they can do a lot of things with that. So you start to think about how might you want to modify what we're doing for some of these other environments. I'm in Houston. Rice University is right across the street from us. They have a global technology group. And so they look at that, the technologies that are being developed for kind of these, low resource environments. And so, we have students that come through and they have that in mind. And I think that's another great, opportunity.
Justin, you've been talking about the influence of attendings on you. I'd like to tell you about the fact that as we grow older, one of the greatest sources of satisfaction is knowing that we have had a part in training people like you. And thank you very much.
Well, thank you, Dr. Lichtblau. It's great to see you. And I have many memories of us in the clinic together and learning from you and hearing the stories. These are things that you just don't forget and really appreciate as time goes on. So great to see you.
Good to see you.
I have a question. My name's Kayla. I'm a senior going to college in September. And so I was just wondering, what advice would you have wanting to do pre-med? What is something that you wish you told yourself at that time?
So in college, one of the things that I experienced, someone telling me, I did a summer program. So I think, and these were things that people encourage. I didn't have the insight to know that these things were really important, but people were pushing me in the right direction. And so I think those really helped. As a college student, I was trying to figure out, am I good enough? Have I done enough work in my college, experience and career and grades and stuff to become a doctor? Did I have what it takes? And you're kind of grappling with that. And I had people, one particular guy, Dr. Richardson is his name, out in Chicago in my summer program, told me that he looked at my grades and stuff. He said, yeah, you're doing okay with that, but we need you in this field. And he turned it on me. So it wasn't about I'm trying to get into something. It was a kind of almost like a responsibility or duty to go and do something good. You've been given some opportunities. And so that was very helpful for me at that stage. You have to know it's a long, there's a long path, but I think you look for the exciting opportunities, and medicine is a great field, and we've seen in this last year with COVID, how important healthcare is, and what we do really matters, and so I think it's exciting from that standpoint if you're a young person getting into the field.
Got it. Thank you.
Mm-hmm. I see Carmen. Hi, Carmen.
Maybe she's on mute.
Yeah, I think she is muted, but good to see.
So how are you balancing it all? Because you have a family, obviously, we wear a couple different hats at work. What's like a typical week for you like?
Yeah, so I am hired into a research kind of position. It's a clinical research position. So on paper, it's 60% clinical and 40% research. So basically 2 days a week is research. And then I have an administrative, role. So on Mondays is a administrative research day. Tuesday is surgery. Wednesday is conferences. We have a lot of conferences and research admin. Thursday is surgery, and then Friday is clinic. So I only have one clinic a week, and that's for all of the orthopedic oncologists. There are 6 of us, and for many years that was the model. You had one clinic day, and then you had your OR days and research. And so, the surgery days are long for me, but that's what I chose to do. And so again, I'll start, the patient comes back around 7 o'clock, and then there's a lot of setup time for a lot of the surgeries. We have to get stents and lines and things like that. And so the surgery will go late into the day, 7 or so. And then, and then we wrap up. That's on a Tuesday. On a Thursday, usually those surgeries go late into the night. But you kind of get used to that. And then you use those other days to kind of recuperate.
Can you go back a little bit to that conversation you said you had with the college counselor about going to med school and that we need people like you? And what would you tell students who are not quite sure if they have what it takes to make it in med school or in orthopedics residency? Like, how do you kind of deal with that self-doubt?
Yeah, I think, you want to be honest with yourself. You want, I think to look at, your interest. Are you passionate? Are you willing to put in the effort and time? It's not easy. And there are going to be, people who say you shouldn't be there. You shouldn't be, doing what you're trying to do. So you have to, be ready for that. I had that experience in a number of different points in my education where people weren't supportive, but I had so many other people who were. And so I kind of just gravitated to those people who were being supportive and pushing me along and helping me, understanding that I'm going to run into people who aren't. But I can kind of manage that when I know that I have a very supportive family and all these other folks who are saying, here, I'm going to help you and show you the way. So, getting yourself, ready and looking back. I always look back, and I tell my wife is a surgeon as well. And then we share these difficult challenges in life. And I always say, I kind of use the things that I got through. And some of that is when I was growing up. My mother and father were separated. There was drug abuse in my family. I got through a lot of that stuff. I was, the oldest of 4. My sister is 13 years younger than me. She was a baby when I was a teenager, and I was helping to take care of her. All those things, you start to look at it, and you say, well, I got through that. I can get through this. I can get through this. I can get through that. And so you just start to build that confidence as you go through these challenges. And that's what they're there for, right? If it was easy all the time, then, you don't push yourself. You don't, get that, that grit that you need to kind of take on, more difficult things. So I think you want to be tested when someone, gives you a challenge. You want that. And sometimes you're not going to do a good job, but you have to learn from that, right? You have to kind of pick up the pieces and say, what did I do wrong here? How can I do better? And I think as surgeons, we're constantly doing that. We're always evaluating. That's one of the things I learned, with, some of the folks on this call, is that even though they were it seems like the top of the game and the world is watching them to see how they do things, they're constantly kind of saying, I didn't do that as well as I should have, or how do I learn how to do that better? And so I really took that to heart as well. And I think I still have a lot to learn.
Yeah, all great points. And do you have kids or?
Yes, I have three little ones, an 8, a 7-year-old, and a 5-year-old. And actually, funny story. So today I had to give a presentation to my 5-year-old's kindergarten class. So at 1 o'clock, I was doing a Zoom call with the class on my profession and what it means to be an orthopedic oncologist. And I thought I was going to get out of it because I've done it for 2 years for the other 2. And because of COVID, I thought I wasn't going to have to do it. And she told me, my 5-year-old is a big personality, and she said, Daddy, you're not going to get out of this. You need to come to my class and give this talk. So there I was today, speaking to them.
And as a parent, how do you feel like you're teaching your kids like the ability to be resilient and develop grit? And
yeah, I think, going back again, I played sports and I learned a lot of that in sports. And my kids are involved in sports. And I've learned as a parent how to use those experiences to teach them some of this. You're not always going to win. My son now plays baseball, and I played baseball for a short period of time and realized I wasn't good. But you learn a lot, and I've started to use those experiences, how to strike out and just walk away and say I'm going to get them next time. Those type of things. I learned from other people, and not in oncology, but some of my other mentors really I thought had a good balance, and they would bring their children along in certain forums to some of the meetings and things like that. So during the holidays, when we were able to, I would bring my children in to make rounds with me. So they come and see our patients and bring them, little things that they've made or candies and things like that. And so they get to see, this side of it, and they're very interested in what I do, and why sometimes I leave, 6 in the morning and I don't come home until the next day. They're like, "What are you doing? You can't be working. That can't be true." And so they're very interested in that. So I think, as they get older, and just showing them kind of the ins and outs. I bring a lot of models home because that's part of the surgical planning. So we 3D print these tumors and start to study them, and I bring them home and I show them, and we talk about what I'm going to do and how I would get it out, and I try and get their ideas, and see if they're ready to help me in the next surgery.
That's great. All right, well, you're extremely busy guy. Any other questions?
I have one more. I'm sorry. So so medical school, and then residency, and then fellowship, there's many years that go into finally being a professional. And it creeps sometimes into my mind, boy, this is a long time, is this worth it, kind of thing. Did that ever creep into your mind? And if so, what allowed you to keep persevering, or kind of being able to, continue to work and stay present in the now, as opposed to looking too far into the future?
Yeah, it's a great question. When I gave the talk to my daughter's class, they asked me how much, time I was in school, and it was 29 years. Obviously, if I would have known that, I probably would have not gone into it. So I'm not sure if I should have told them that it was 29 years. But I was just kind of going along, right? I, didn't have a really long-term plan. I was just, trying to, get into medical school at Mount Sinai, and then have an interest in orthopedics. So I wanted to do, get experience there, and get into the lab and work, learning some biomechanics. And those were, my day-to-day things. And I wasn't thinking, how long is this going to take, and when am I going to get my first paycheck? That I didn't think about. And that maybe that was, a good part of, my kind of my process, and not thinking about, the financial side. I went after residency to Liberia for a year, and some people were like, "Why would you do that? You're kind of delaying your payday." And I'll tell you, that was one of the most important years of my life. I got a lot out of that, and I didn't get a lot of money, but those things are priceless, right? So I'm more about, experience. Things are gonna, I in my mind, work out, and that's how I was always thinking of it. It's going to work out, even when I saw difficult times. And maybe that goes back to my, my childhood and growing up and seeing difficult things and figuring out, okay, it's going to work out. There'll be, be better days and things like that. So.
All right, that's great. Any last questions?
Thank you.
Hey, Justin.
I remember
Phil?
when you spent time in the lab, and I remember your project was one of the most successful ones done by a medical student. It was when you were a medical student, right?
Yes, it was. I was a medical student, and it was a great year. I had to learn MATLAB. I bought a book, like it was like MATLAB on, for dummies. And fast forward, now
I
just
remember that.
recently wrote this grant, and we're talking about doing finite element analysis for like spinopelvic reconstructions and talking about MATLAB and some of these other programs. And I'm like, man, I can't believe I did that way back when. It was
Justin, Phil is not easily impressed.
I know.
Well, I thought
The
that
phonies do not go far with Phil.
I remember Justin really, he did teach himself the MATLAB, and he really took charge of the project and moved it forward to a very interesting results. And I was wondering if you could just kind of recap that a little bit, and just as an inspiration for some of the students. I mean, I know it was a small step of all the things you've done in your life, but for the younger people, this might encourage them a little bit.
No, it was a really, I think, a great experience. I learned a lot. And our project, we were looking at, some of the age-related changes in bone and osteoporosis and how that affects the strength over time and why people get fractures. And so it required us to take x-rays of bones, and then we were also getting cross sections of the bone and analyzing them, and started to realize that people get certain patterns on how they age, and there's something called endosteoresorption, and where the bone on the inside is eaten away, and then to compensate for that, you put bone on the outside. And there are some, principles that I learned that I still use to this day.
Moment of inertia.
Yes, moment of inertia, and you don't have to put as much bone on the outside because it's to the fourth power. So you take a little bit, you take some away from the inner part. You only have to put a little bit on the outer part to maintain the same amount of strength. That's something I learned. How many years ago was that, Phil? I can't remember, but it's like, it's still fresh in my mind because you and others, kind of beat it into me.
Yeah, that was back during Carl Jepson's
yes,
time.
Yes, Dr. Jepson's. He was a great teacher, and yeah.
All right, great, Justin. Thank you so much for taking the time. This has really been great.
Yeah,
discussion.
and I'd love to do this anytime. It's great to see so many friendly faces, and to all those students who are thinking about going down this path, I highly recommend it. If there's anything I can do to help anyone who's ever in Houston and wants to see MD Anderson or the work that we're doing here, they're welcome. And you can please share my email to the students if they want it, or my phone number.
Thank you. Thanks.
Thank you very much.
Thank you. Guys,
Thank
take
you
care.
so much.
Thank you.
Thank you.
You.
Thank you, Justin. Inspiring.